question that healthcare is a major problem in the cost of healthcare is a major problem for most Americans. Employers for the past several decades have been burdened with the responsibility and now the crushing cost of affording healthcare premiums for their employees. William Gallagher Associates Employee Benefits Practice has spent a significant amount of time working with our clients to develop creative and cost-effective programs. Our hope is that when whatever happens in healthcare reform, that there will be enough flexibility and enough creativity in whatever products come out and whatever plan requirements come out to allow us to continue to do that with companies who see employee benefits as a critical component of their total compensation program. In our work with the Washington, D.C. based Council of Insurance Agents and Brokers, and CIAB, we've had the opportunity to spend some time with congressmen, senators, and key staffers on Capitol Hill trying to give voice to our clients, their concerns. Certainly, our clients have expressed interest in our federal government finding ways to make healthcare more affordable. Unfortunately, I think what we're seeing come out of these bills is a focus really on the insurance industry and less on the cost of healthcare. The cost of healthcare, your time and dollars spent in hospitals and provider settings, is typically about 90 cents of every dollar of healthcare expense. In our time on Capitol Hill, we've tried to emphasize that Congress and the Senate should be focused on the healthcare delivery and creative ways to make hospitalization and cost of care more affordable. Ultimately, any program that's going to have an impact on the overall cost of premiums and the cost of health care in the United States has to look at the consumer. Unfortunately, in this country, we've spent a significant amount of time providing a rich benefit plan to employees who then lose sight of the cost equation through no fault of their own. Access to outcomes and cost information at both a hospital and other provider settings is almost impossible to get, and when available, difficult to decipher. I think one area where the federal government could have a significant impact is in enhancing the member's ability to be a real participant in the economic equation of healthcare delivery. We have hospitals charging exorbitant fees that aren't necessarily related to outcomes, and members choosing those facilities based on perceived reputation. There needs to be more of a focus on providing the end member not only with financial incentives and penalties to participate, to make good healthcare decisions, but to get good information into their hands so that they can protect themselves and their families in their healthcare decisions.